Ever since Linus Pauling speculated that high doses of vitamin C might cure cancer, there have been a number of reports showing that not only is there little effect or no effect on cancer by taking vitamins, but sometimes a detrimental effect. Until today. The Journal of the American Medical Association reported an article where men, older men, who took a single Centrum tablet a day versus those that took a placebo had a small, modest reduction in cancer. But let's put this in terms that you might understand. If you follow 83 people for 11 years, you will have one less cancer in that group. The time of death, no change. The mortality from cancer, no change. The major cancers that people are to develop, such as prostate cancer and colon cancer, no change. This was a small but significant change in some forms of epithelial cancer in some men. Now, let's put this in reality. If you want to reduce the risk of cancer, the better things to do are to stop smoking, lose weight, eat a balanced diet, and use sunscreen. Those are hundreds of times more effective than taking a multivitamin a day. But the minimal adverse effects of this do point out that this may open a window for a certain group of people. However, those statistics are rather tenuous, and over time it may not show to be of any effect. To put this in context, other studies with vitamins and other cancers have been checked, and all have been uniformly found to not really impact cancer, with the exception of a Swedish study of 35,000 women where there was a reduction of breast cancer. Here's the bigger news. Sadly, our news reporters no longer have science journalists, because when you look at the LA Times and the New York Times, they got the statistics wrong. They don't understand there's a difference between 17% and 17 events per 1,000 patient years. Nor do they understand a reduction of 8% isn't really 8%. They got the numbers wrong. Sad reporting for journalism, but we will try and place it more in context for you. So here's the bottom line. If you're an old man who's reasonably healthy, generally don't smoke, take an aspirin every day and supplement it with a Centrum Silver, you may, over the course of your life, have less of a chance of having cancer, but you'll probably die at the same age. And if you do get cancer, it doesn't matter whether you take the vitamin or not. It will not change the ultimate outcome of that tumor. Otherwise, why not? For your doctor's orders, I'm Dr. Terry Simpson. Please feel free to comment on our blog, which you can find at yourdoctorsorders.com. Good day.